people. Welcome to today's live streaming. I'm Health Educator Mike. Hope we all are doing fine. Right, so just like you all know, this particular channel is for health promotion and disease prevention channel. It's a channel where we come to interact and give you guys the tips that you need to move your health to the next level. So we say what we do here is taking healthy living to a global scale. That's what we do on this channel. So um, do well to share our videos, do well to um, subscribe to this channel if you're joining us for the first time. All right, so do well to subscribe to the channel and also turn on notification um, so that you'll be able to receive the information, all right, whenever we are starting our live streaming. So in this channel we learn a lot of things, so which will be beneficial for both the healthcare providers and healthcare consumers. So that's what we do in this particular channel. So what we just stand for is just promotion of health in general. So um for some times now we have been discussing about skin conditions, different skin conditions, right? That people are having, right? So that we can be able to differentiate them, then know what to do whenever we are having a particular skin condition. Is not um, when we are having a fungal infection, we start using an antibacterial, it will not be of a help. Or we are using or if it's allergic reaction, we are using a different medicine for the treatment. It will be a waste of money, and also it may complicate the conditions the more. So we started with the discussions on acne vulgaris, which shows in the form of pimples, blackheads, and so on. We also discussed about atopic dermatitis, which we say that is a genetic disorder anyway, is inherited, and that particular inherited condition can be triggered by many things, can be triggered by allergic reaction, can be triggered by stress, can be triggered by heat, and so on. So um, when it's triggered, it will begin to give signs like itches, see patches on the body, right? It's very serious itches, but it's not contagious. Just like I mentioned, it is not contagious unless with that inches you're able to open up the skin through that scratches, and it now have a bacterial infection. You develop a bacterial infection. If not, it is not contagious. Atopic dermatitis is not contagious. We also discussed about psoriasis. All right, we discussed about psoriasis, and all those things is things of which we're expected to know. We say that psoriasis is it happens when the T cells, which is part of the immune system, attacks the healthy skin cells, all right, leading to what overgrowth of skin cells, and it shows like when you're having patches on the body and outgrowth or raised patches, all right, on the body, or maybe in the finger you begin to see um, a skin that is just growing out, or you see a breaking of the foot, all right, that's showing an outgrowth, all right. All those things is sign to tell you that this is psoriasis, all right. That's what you are having, and you need to actually take note of it and know what is causing it. We say that what is a result of the immune system attacking um, the cells of the skin, the healthy cells of the skin. So it is not also contagious. So please take note of that. Now, um, today we are going to discuss about contact dermatitis and also tinea, all right, aka ringworm. So that's what we are going to discuss now as a skin condition, so that we not have misconceptions on different skin conditions. When we know exactly what we are treating, or we know um, the direction that all these the signs and all these symptoms of a particular skin condition is given, then we know how even the diagnosis we are going to make which will be channeled to a specific part, instead of we just using medicine randomly, all right, empirical treatment. Now, we are going to start with contact dermatitis. You may ask, what is now the difference between this contact dermatitis and atopic dermatitis? The just clear difference is that of atopic dermatitis is actually an inherited condition, all right, that is triggered up by different things, all right. Even allergic reaction, other things comes in, and before you know it, you begin to notice itches and so on. And that particular atopic dermatitis, it doesn't go away, right? Is always in the body. That inherited condition is always in the body. So once it gets any trigger, it will kickstart maybe stress, heat, all right, allergies, all right. Once it see anything of that nature, all right, it will just kickstart. And that of contact dermatitis is not always in your body, all right. So it's not always in the body, it's not an inherited condition, but it's a skin reaction that happens when you come in contact with an allergy, all right, or thing that will give you an allergic reaction. That's why we call it contact dermatitis. Dermatitis is what? Inflammation of the skin. So contact dermatitis, so which is to say that you get that inflammation when you come in contact with that particular allergic reaction or allergy, all right. When you come in contact with that allergy, then you get that irritation of the skin. And there's a lot of things that could cause that particular contact dermatitis. It could be the cream you are using, it could be from soap, or even perfume, right? It can come from perfume. It can even come from the water you are using to take your bath. Anything that can give you allergic reaction, once you come in contact with something you are allergic to, all right, before you know it, you begin to notice itches all over the body, all right. You begin to notice itches, begin to notice erased patches, all right, on your body. That's what you'll be noticing, all right, which is that of contact um, dermatitis, right? So when you notice all these things, having seen that is a result of what? Allergic reaction, right? What you need to just do in order to handle the issue is by using some steroid creams, right? Like we have mentioned, you see almost the same thing with what is used in treating that of atopic dermatitis, all right? Using like all these um, hydrocortisone and so on, even clobetasol. So all those things will help, but more of hydrocortisone, pyridine, all those kind of things. But in any way, you need to seek medical help so that you know exactly what is wrong. Not whenever you start having such inches, all right, because I said you now go and start self-medication. You may not be sure because I'm not there with you to properly diagnose the condition. That's the reason I'm mentioning different skin conditions. Let us not take every skin condition as eczema, or take every skin condition as fungal infection or ringworm. Let us not take every skin condition to be psoriasis. Let us not take every skin condition to be vitiligo. All right. So we need to be able to differentiate them. So whenever you're having this condition, it's just for educational purpose, you quickly go to health center and get diagnosed. A healthcare professional will look at the condition, then be able to know what the condition is all about and go for specific treatment. Diagnosis can be done so that they know exactly what is wrong with you, instead of you guessing it may be this, it may be that, and start medicine at home. Now, for that of Tinea, all right, aka ringworm. So I'm still going to tell the difference between the Tinea and that of other skin condition that you can see. In fact, the thing is very, very different from others. Very, very, very different from others. Right? It's not the same at all with others. Now, um, when you talk of that tinea or ringworm, what happens there is that you begin to notice you begin to notice a raised patches, all right, that is round. Raised what? Patches that is round. That's why we call it ringworm. Ringworm, tinea. All right. So, and most of the time, if you want to differentiate it with other skin condition, if you check the middle of it, the center of that ring is always clear, right? It's clear. There's no issue in the center. The skin is okay, but it will go round to round that particular part of the body. All right, so it can happen anywhere around the body. It can happen um at the skin, all right, which we call a tinea corporis. That's what we call it. It can happen at the scalp, which you call it tinea capitis. All right. It can also happen in the foot, all right, which we call tinea pedis. And also it can happen at the groin, all right, the groin area, which you call tinea cruris. All right. So that's what we call it. So we actually need to know how this particular works, this tinea. So whenever you are having tinea, which is ringworm, what you need to do is to treat it with an antifungal cream or medications. All right. Of course, tinea is contagious. Just contact with skin, right? You are in contact, or you come in contact with the person that is having it, the skin. Definitely, you are going to contract that particular ringworm. All right, you are going to contract that ringworm, which is tinea. So it's very common. It's very contagious. And it's something that whenever someone have such condition, you need to actually maintain personal cleanliness. You need to make sure that you don't spread it to other people. So know how you are going to start off the treatment at once with antifungal creams, with antifungal tablets. All those things will help you to maintain your health and also take it to a greater level, instead of you waiting to know what is happening. It can actually lead to discoloration of that particular part of the skin, and it will make you to be restless. It can damage your skin over time. So it's something that you must treat. You must treat it. Very important. And whenever you are treating fungal infection, please take note of this. Fungal infection, unlike bacterial infection, that you just treat for 5 days, 7 days on a prescription, they say you are okay, you are good. That of fungal infection takes a lot of time for it to heal. All right, it takes a lot of time for it to heal. All right, so it can take as much as 1 month. Some of them, let's say fungal infection of the nails, it can even take up to 6 months before it will heal. So it's something that you need to make sure that you are taking your medication consistently. For even 1 week of treatment, you may not even notice any change. All right. And some people will treat it, let's say 2 weeks. Depending on the type that you are treating, which is the reason you need to consult your healthcare provider for any treatment you want to undergo. Now, you can treat it for 2 weeks, you think you are done, especially let's say that of fungal infection of the nail, all right, or the scalp, all right, tinea capitis. You think you are done, all right, because you have cleared. It haven't cleared in the blood, so it is still there. So you need to take that medicine as recommended by the healthcare professional. If the healthcare professional said you use the medicine for up to 1 week, please complete it 1 week. If you say 1 month, complete it 1 month, because this particular fungal infection can be very, as in it can take a lot of time for it to clear from the body. So you need to take note of that. So tinea capitis, tinea corporis, tinea pedis, tinea cruris, all of them is something that you need to be aware of, which is different from other skin conditions, in the sense that whenever it happens, it's contagious one, and also when you contract it, it will begin to form a circle on your skin, on your scalp, on your foot, or anywhere it is forming. Right? Mostly it will form what is circle, which we say is ringworm. It will form ring shape, and the center sometimes is always clear, right? It will have what clear center, which is to tell that this particular one is a fungal infection, is a ringworm. So now, and it used to be very itchy, all right? It will itch you, and it always have a raised patches, all right? So it's raised. It's not like that of atopic dermatitis, all right? This one, it will be raised, all right? You are going to see it, even if you are to scratch it, all right? Based on how this is giving the sensation for you to scratch, you are going to notice that you just start wounding yourself, all right? Because of what it will have, what raised patches on the skin. So that's what happens. Sometimes it will be a bit scaly, all right? It will become scaly. So that is how it happens on the body, which whenever you notice any condition as regards this fungal infection, you just quickly go to the health center, get diagnosed, all right? Um, Tell the health workers your problem, and they will explain it better for you. They will make the necessary prescription for you, instead of you sitting at home and be buying different medicines that is not going to work. All right. Because if you are treating atopic dermatitis, you are treating contact dermatitis, not knowing fully well what it is all about, you start using something like penicillin ointment. You are just on your own because you haven't done anything, all right? Or you are using a medicine that have maybe neomycin cream. You are just on your own. You haven't done anything. So you must go with the one that does specific work, right? The one that works in that direction. That's what you must use to cure you of that particular health condition. So we have discussed about that of contact dermatitis, which we say it happens as a result of you being in contact with any allergy, right? And there are many things that could lead to this allergy. It could be the soap you are using, it could be some perfume, the perfume you are using, it could be even the water you are using to take your bath, or anything that you are allergic to, right? So whenever you come in contact with that particular allergy, it will now begin to give you those rashes, those inches, making you to be restless. All right. So is whenever you come in contact with it, that's why we call it contact dermatitis. Contact, then dermatitis. inflammation of the skin, and that of fungal tinea, which is ringworm. We say that what that one is contagious, and what happens there is when you contract it, it will begin to develop on your skin, giving a ring shape, all right, which you say is ring worm, and it always is always a raised patch that is very itchy. When you scratch it, it can even form wound, and the center is always clear. And if you want to handle it medically, you want to treat it, you go for antifungal tablets and also creams, all right, and you don't expect it to clear within space of 1 week, 2 weeks. Some of the fungal infections can take as much as 3 months, 6 months, depending on the type, which is the reason you must seek medical help whenever you are having those issues. And once a prescription is given to you, make sure you complete it as recommended, instead of you to say, okay, it have cleared, let me forget about this medication. It will definitely come back. So fungal infection is more stubborn than that of bacterial infection. Please take note of that. All right, it's always more stubborn, especially that fungal infection of the nail, all right, or even the foot, which is the tinea pedis. So please do well to get yourself diagnosed each time you are having any health condition, all right, that you are not aware of or you don't understand, right? So just do well to get diagnosed, seek medical help, go to the healthcare center, all right, and get medical help and get assistance that you need, get the care that you need from the healthcare center. It will go a long way in helping you to maintain your health instead of spending your money, and at the end of the day, you are not getting any positive result in that treatment. All right. Just like I always say, I say if you get yourself diagnosed and know exactly the cause of an illness, you have gotten 50% cure for that particular illness. You need to just know what is happening. All right. So that you know how you are going to handle it. So see you guys tomorrow by 10 a.m. on our live streaming. All right. So we are going to be here tomorrow by 10 a.m. All right, so we stream every day. Once you get this video, you have any question to ask, please do well to put on the comment section. Once I see the notification, I'm going to attend to it immediately. Once I see the notification, and do well to share this video. It's going to be of a benefit to the whole world. All right, it's going to be of a benefit to all of us, to healthcare consumers and healthcare providers. So it's going to be of a help. So it will help us to stay on the know. We are still going to discuss other skin condition that we are having, that we need to differentiate or understand better, so that whenever we're having those conditions, we'll not go and treat a wrong one. So please do the needful by sharing this video. That is your own role to play. All right, I have done mine by bringing the tips to you for your own hearing and understanding. So see you guys tomorrow by 10 a.m. guys. Thank you.